Good morning, everyone. My name is Bela Sood. I'm a professor of psychiatry and pediatrics at Children's Hospital of Richmond at Virginia Commonwealth University, and here to talk to you today in May, which is the Mental Health Awareness Month. We all know how difficult this past year and a half has been. COVID has impacted all our lives in different ways, in intensity as well as the types of difficulties we have. We very much know what to do when a child has a scrape on the knee, a fracture of the arm, or even a sore throat. We know exactly what to do. But oftentimes we are frustrated, puzzled, and just do not know what steps to take when we see a child flailing secondary to emotional difficulties. Their grades might be going down, they look quiet, isolated, withdrawn, or they might snap at you, they're irritable, and you wonder what's going on. The first step that I would suggest to you is to sit down and talk with your child. That conversation will reveal so many different things. Do it without judgment, just be open, listening to them and hearing what they have to share with you. Figure out if there are stresses which they're responding to. They could be being bullied, or they might have a breakup of a friendship which they valued, or a romantic relationship which has gone awry, or some other thing which you had no idea about. But just being there to listen can reveal a great deal about your child. The next step is to wonder, who should I turn to? And of course, your pediatrician is perhaps one of your best resources. Your pediatrician knows you and your child right from the time they were born and has a very good finger on the pulse of what might be different about your child. They can use rating scales, they can use other ways of figuring out what should be the next steps. Should they be taking care of your child? And is that just fine? Or should they be referring to a specialist, such as a child psychiatrist, a psychologist, or a social worker, or even a guidance counselor in school? These specialists might be able to take your child to a different level by exploring what might be going on and determining if therapy is needed, that is talk therapy, or are medications indicated, sometimes for depression as well as for anxiety and some other problems. Medications can assist in calming the mind down so that talk therapy is more effective. Even more than that, a counselor can assist you in reaching out to resources within the community which might help your child, such as getting them involved in activities which might help the underlying problem, and reaching out to other resources that they might be aware of. The Cameron Gallagher Children's Mental Health Resource Center at the Virginia Treatment Center for Children is a great resource for figuring out who is the right therapist for your child. However, of paramount importance is taking care of yourself, because if you're not well, your child is going to have a hard time themselves. Remember the adage, put on your own oxygen mask before you put it on your child. And the dictum that there is no health without mental health. If your seat of reason is awry or is not going and functioning well, then the rest of your body is going to follow suit. So, investment in mental health, being aware of what might be going on differently, what are normal developmental phases of life, really getting yourself up to date on those cores are so important. Have a great day, a great month, and a great year as you are awakened to the idea of taking care of your emotions along with your physical body, because that is the best investment you could make of your time, resources, and for the future. Thank you.